The East LA Barrio Free Clinic came out of that period, the civil rights movement of the late 1960s. It was set up by a group of community activists, including the Brown Berets, as the first aid station to begin with, but eventually it became a free clinic. There was an understanding, I think, the need to have a clinic that addressed the healthcare needs of the populations in East Los Angeles. The mission statement of AltaMed always has been to provide accessible healthcare to underserved communities. 55 years of service, the millions of lives that we have touched over the course of that period of time, I feel extremely proud of where we're at today, and there's a lot of reasons to celebrate.
Trying to understand why AltaMed is dedicated to the underserved communities in LA and Orange County is like asking us, why do we breathe? Ultimately, we are a social justice organization. We were created, obviously, to provide healthcare, but healthcare for us is, in fact, a social justice issue. Being able to understand the culture and the language and the motivations of a community is going to help us not just understand how we serve them, but also how to create social mobility.
If AltaMed did not exist, there'd be large parts of the community that would be going to emergency rooms of every hospital in Los Angeles for basic care or for things that today AltaMed is treating and helping. They play such a vital role in just the entire healthcare ecosystem of Los Angeles that I cannot even imagine LA without AltaMed.
Each time I'm somewhat taken back and overwhelmed by the kindness, the caring, the thoughtfulness, the excellence of medical care that they are providing, how they anticipate what their patients need. It really touches you to the core and wants you to go out and help bring in more funding so that they can reach as many people as possible.
Yo me acuerdo muy bien de esas palabras. Eres poco de los que regresaste. Te voy a sacar adelante. Es muy raro encontrar un doctor así.
Toda la atención, se ve que se esmeran por uno, se preocupan por uno, y eso vale oro, ¿verdad? Así es que por eso estoy enamorada de AltaMed.
If we had not moved to AltaMed, if my mom were not a patient of AltaMed, I wholeheartedly believe that she would not be here with me today.
At AltaMed, you don't feel like a number, you don't feel just part of the system. You feel like actually you have someone that cares.
At AltaMed, we recognize that health isn't just managed within the four walls of our clinic. It's very important that we go beyond that. 20% of health is taking care of illness. The other 80% is managing the social determinants of health, the issues affecting our communities outside the walls of our clinic.
In my mind's eye, I see a community that is vibrant, where moms and dads can be sure that their children can go to a safe school and learn, where hunger isn't the reality that we deal with every day, where people are not scared that next month may be the last month that they have shelter, and that people have all of the opportunities that they need to make their lives better. To do that, you have to be healthy, you cannot be hungry, you cannot be exhausted.
HELP is our 4 pillars of success. H for health, E for equity, L for life, and P for programs. This unprecedented effort will raise $110 million to uplift our communities. We will strengthen prevention and early intervention, create fair environments in which our patients can live, help families avoid crises, and find innovative solutions.
The state of California is due to be short about 44,500 nurses by 2030.
By raising funds for the nursing program, which I'm truly excited about, We're going to be taking people from the community and giving them the training they need to in all levels of nursing, so they have a career path in their own community, and so they can provide services to the people in their community. It's exciting, it's innovative, it's unusual, and I'm proud of it.
Art has always been a critical part of this thing called the Chicano movement. The expression of our history, the expression of our present state, and the expression about the artists and the creative people, that expression of freedom, if I may, is such an important part of the soul of a community. So to me, to be able to bring that to our facilities, as our patients sit in the waiting room or walking through a hallway, to be able to see that history, something that they connect with, that sense of pride. It's part of the healing spirit, if I may. It's a part of healing of a community.
It really is a way for AltaMed to honor the rich cultural tapestry that exists in Los Angeles. Whether it's around Asian Latino artists or Afro-Latino pieces, it's just a way to really reflect the rich diversity of Southern California.
El movimiento is alive today in people like me. What's here in terms of that period of time, that period of humiliation, that period of discrimination, the periods that we lived and circumstances that we lived, that's what continues to fuel that movimiento. It is a sense of consciousness, it's a sense of responsibility, it's a sense of commitment to change and create a healthier environment, a healthy society for all people.
Please join us in supporting the HELP campaign.
Health,
Salud.
equity,
Life,
Programs.
our future.
my future,
Mi futuro.
My future powered by you.
Powered by you.
Powered by you.
By you.
By you.
Powered by you.